So you might grab a cup of coffee with your legislator if that's something. That's definitely something I would recommend doing. Like, Leah, you mentioned you were working in city council a lot. So that would be a great thing to do with your city councilors and try to, again, build that relationship and establish that kind of connection with them so they know where you're coming from. So the full body vote, this is where they're just like literally voting on the bill. And so the bill can either die at this if they vote ITL on the bill, or it can continue on. And sometimes it'll go to a second committee if it has a fiscal note on it. So if it deals with finances in any way, sometimes it needs to go to like the finance committee or the commerce committee, who will look at that, who are tasked with only looking at the financial aspect of it. And they might have a public hearing, they might not, but they will, again, vote on a recommendation, and then it has to go to the full body for a vote again. So then we have it in, we call it crossover in New Hampshire, where by the end of March, there's a deadline with which all the bills that started in the House have to have crossed over to the Senate, and all the bills from the Senate have to have crossed over to the House. The ones that passed, the ones that died are obviously just, so it goes to a committee in the second legislative body. So there's different committees per legislative body. There is some overlap, like there's a Health and Human Services committee in the Senate, and there is in the House, but there are some committees that don't so cleanly overlap. So definitely just pay attention to that and pay attention to kind of what the makeup of the committee is and how folks on the committee are like reacting to the bill. So there's also states will do this differently, the way they deal with crossover, the way they deal with public hearings. I found out in Vermont, they actually have one public hearing per bill, so that advocates only have to come out once, and legislators from both the House of Representatives and the Senate committees will sit in on that public hearing. And I was like, that's brilliant. That's so smart. But in New Hampshire, we don't do that. There is a second public hearing in New Hampshire in the second legislative body. And we always stress to our advocates, it is just as important that you show up for that second hearing as the first one, because it's a different audience, it's a different group of people that you're educating, and it's a different hurdle that you're trying to overcome in this legislative process. So you have to do the same advocacy you did the first time, just the second time around, for a different group of folks. So this is the same thing. You're going to want to show up, you're going to want to testify, you're going to write, submit written testimony, perhaps call the committee members or call any committee members that are hostile to the bill. And then they're going to vote on make another recommendation again. So it's going to go to an executive session, they're going to recommend, and then it's going to go to a full body vote. Not much else to say about that. Same as the time before, it might go to a second committee. And so if it passes out of the second body is when it would go to the governor's desk for a signature. However, if the second body passes an amended version of the bill, so I haven't really talked about amendments, but amendments can happen in committee. And so say the second body amends the bill and then they pass it. They've technically passed a different version of the bill than the first body did. So either the first body can concur with the amendment and say, we're fine with it, go ahead. Or if they have some issue with it, there's gonna have to be a committee of conference. And this has a conference committee, has different names in different states, but it's basically where members of each of the two committees that the bill went through have to get together and come up with a compromised version of the bill. And in New Hampshire, at least, if they can't compromise on that, they can't come up with a compromised version, the bill dies there. So that's an extremely frustrating loss for if you've been advocating all along this process and then they can't come to a compromise and then the bill dies. But if they do come to a compromise and every single person on the committee signs off on it, then it will go back to both bodies for a final vote to pass that new version of the bill, and then it goes to the governor's desk. And the governor, three things.
Sorry, do they need to have a majority? Or is it like how many people need to vote for it in order to pass in the full body vote?
In the full body, it has to be a simple majority, yeah. So here it's whoever is present that day, like a majority of whoever is present. In Georgia, it was actually the total number of representatives. So that would be like 200 out of 400 would have to agree, which is just never going to happen here because we only get about 300 on average that show up. So that like nothing would get passed if that was the case here. But that is definitely something you would want to know about your own state, is whether it's the majority of whoever's there, or the total majority of people.
And do the state senators, like, I'm sorry, I'm just confused. They're part of the full body, right? Or
yeah, so when I say full body, that's either in the Senate or the House, depending on where the bill starts. So it's going to go through, it has to go through both bodies, but it starts in whichever one the person who introduced the bill is in.
Got it.
Okay. Oh, someone's joining us.
Good morning.
Good morning.
I'm actually going to join by phone in a little while too, because I have to get outside.
All right.
Keep going. Stop me now.
All right. So on the governor's desk, he can, sorry, I say he just because we have a male governor right now, but the governor can either sign the bill into law, veto the bill, or do kind of a passive aggressive route and not do anything. The bill becomes law after 5 days without a signature. So that's if the governor doesn't want their name attached to it for political reasons, it will just become law. And then there is a thing about a veto override. So if the governor vetoes a bill, it can go back to both the House and the Senate for a veto override vote, but it has to be 2/3 let me say this correctly. In the House, it's still 2/3 of whoever is there that day, but in the Senate, it has to be 16 out of 24 in order to pass. So it changes there in that situation. And that actually does happen. It's not common, but it definitely does happen that vetoes are overridden. So that's a lot of information about how a bill becomes a law, but does anyone have any questions?
Are there benefits to like introducing it in the Senate versus House, like in the beginning?
Yeah, definitely. So we definitely can have discussions around what's more strategic. In our state, it has to do kind of with whether you're trying to get 24 people on board or trying to get 400, trying to appeal to 400 people. But it also really has to do with your relationship with the legislator who's introducing the bill. So if you have a really strong relationship with a representative who is really going to champion your bill and advocate for it and try to get their colleagues to vote for it, you're going to want to go with them rather than someone who just is kind of like taking it on as another thing but doesn't really care about it. So it also has to do kind of with your relationship with your legislator and who's gonna champion that bill. So there's definitely different considerations around it, but mostly I think it comes down to who do you have the strongest relationship with, who can take it on. And something else we'll tell folks too is like if your direct representative or senator isn't interested in introducing a bill, but you do some research and find out based on old voting history or just stuff that, I'm sorry that my phone is going off. Maybe you hear that they've really championed this issue in the past on other things. You could always reach out to them and work with them, even if they're not your direct representative or senator. If it's an issue that they've cared about in the past, that could be someone strategically that you would want on board.
And sorry, you might have mentioned this, but I think I got a little lost. Is the committee?
It's a lot.
Is the crossover committee, like when you cross over, is the committee the same committee that's the original committee, or is that a different committee?
It's a different committee. So it's, so like say a bill started in the House and went to a House committee first, it's going to go to a Senate committee after. And the committee is still going to have like a designated focus, like say it was Health and Human Services in the House, we have Health and Human Services Senate committee as well. But it's a different committee with different members because it's in a different body. Any other questions?
I have a general question about,
Yeah.
because I didn't know about New Hampshire's legislative process before hearing you guys present on it. It's pretty, I think the biggest element that stood out to me, but they're obviously the whole system in general, it seems pretty democratic. I mean, it seems like it's a pretty kind of layered process. You know, I'm curious how campaigns are financed, even though they're, you know, volunteers. You know, I'm sort of wondering how much you guys know about the legislative landscape in other states, and how much it seems like legislators are really representing bills that have merit, beyond like their cousin wants the bill passed kind of. Like my experience of legislation in North Carolina, where they're like, who do you know? Like, not just like casually, not your neighbor, like who is your uncle on the legislature if you want a bill passed. And I mean, that's not always the case, but that's what I've experienced.
Yeah, no, I think that that's definitely true. And I know I can't personally speak to other states' legislative kind of landscapes and culture. I do think in New Hampshire we are pretty lucky in some ways that our process is like this. And then there's obviously issues in other ways, such as the fact that like a lot of people can't be legislators because they can't afford to not be paid for the work that they're doing. I think that that's a really big hurdle to representation here, but I do think that it does take that element of kind of career politicians who are in it to make money and maybe not in it because they actually want to be changing their communities for the good. So I don't know, Megan, if you have any thoughts on that.
No, I mean, I think what you said is true. I think that we have here on a smaller scale of some of the issues that you're talking about, like when we tell somebody that when somebody's going to run for a House rep, we tell them like, you probably want to raise like $1,000. So like campaign finance can come into play, especially with our senators and our gubernatorial races. There's a lot more that can go into there. But in some ways, it's still a very much like who's your neighbor legislature, get to know, become friends with your representative sort of thing, which pros and cons. For sure.
So this was really great. Thank you. If I wanted to put something like what you've just presented to us about New Hampshire, about Louisiana, do you have any tips on how I should go about that? Like, did you pull were you able to get a lot of the information about Georgia just from the government website, or, you know, anything you got would be helpful?
Yeah, I actually, last year when we did this training, researched Louisiana. I don't know why I didn't remember that until right now. So I can send you all the materials that I pulled together last year about this. I'm going to have to do some digging in my computer to find it all, but I did pull together some information, and I found a really great advocacy organization. I believe they advocated for disability justice, and they had a lot of this information on their website. So they were similar to New Futures, where they were trying to help their advocates navigate the process, and they had a ton of great information on their website. So I'm going to make a note right now to make sure to send that in the follow-up information. But I found all that, yeah, just literally through doing some Googling. But it also helps to kind of know what you need to be Googling for. So I think I can give that material to you to start, and hopefully that can get you on the right path. But a lot of this information we actually put together just from the experience of our policy staff, was kind of helping to advise how we explain this process, and built this game board to go through it. So I'll send you that information though, and I think that hopefully that will help.
That'd be really great. Thank you.
I think that's a good point. Oh, sorry, go ahead.
No, go ahead.
I think that Jess made a good point though of there are lots of organizations that do advocacy, like there are New Futures in every state, and you probably have somebody in your state, at least one organization that does this sort of legislative process work, but then a lot of them are based on specific issue areas too. So I would be surprised if there wasn't like a health advocacy organization that exists in your state that can walk you through what are the bills to be paying attention to this legislative session, how does the bill become a law in your state, when's the best opportunity to call what lawmaker on this, who do that sort of like strategic thing for a living. That's always like our number one thing, that here's a list of New Hampshire-based advocacy organizations. Find the issue that you care about and get in contact with them, because you all have lives that you live and you have very important jobs that you need to do. And like, it's ours to help other people be able to advocate and not have to follow this process obsessively the way that we do.
I had a quick question, and you might address this later, but like, who are your primary opponents? Like when you try to introduce legislation, I know New Hampshire is like a very small state, but do you have lobbyists that are primarily funded by like private, pharmaceutical companies or insurance companies that are like actively lobbying against you when you try to introduce legislation?
Absolutely. So we'll have, because we're such a small state, with some of those issues, we'll often have like lobbyists fly in when they're paying attention, when a national organization cares about an issue, and they'll come in and speak to New Hampshire. But we also have, we live in the state capital. We have many paid lobbying firms that exist here, and with a lot of different national clients. So we work with some paid lobbyists who are, like our clients at New Futures, and then pharmaceutical companies, insurance companies, I don't know, lots of different opponents have paid lobbyists that are working against us.
However, you got to think too, with the ones that fly in lobbyists from out of state, they don't have the community relationships that New Futures has built. So they're just going in and giving their spiel, and they don't have anyone else going to back up what they're saying, which we like to think gives us an advantage in that situation, and how we were able to get, for instance, the pharmaceutical bills passed this year, addressing high drug prices. There's definitely a lot of opposition from pharma and insurance companies around that. And we actually had to lose one of the bills that we were working on when a whole bunch of stuff happened, and all the bills had to be packaged into one bill in order to get passed. And we had to strategically take one of the bills out because we knew it would bring down the whole bunch. But we were able to get all those bills passed in large part because we had so many people showing up and sharing their personal stories about not being able to afford their prescriptions, and how that was impacting their lives. And those personal stories, we're going to talk about personal stories actually in the next section. Personal stories really are often what push legislation forward. You can talk facts and statistics until you're blue in the face, and sometimes it won't get through to people. But when you get at that heart and that emotion, and really like make people realize these policies are impacting people. It's not just words on paper. This is really impacting people's day-to-day lives. And you break through and really get to that, that's when you can start to really change minds. So we'll talk about how to build an effective personal story when you're advocating. But for you all, it might be talking about what you're experiencing with like your patients. and bringing those stories forward, of course, respecting HIPAA confidentiality and everything, but talking about, I keep seeing people that are experiencing this issue over and over and over again. This is how it's impacting their lives, and really laying it out and making it that personal story. And that's what gets legislation pushed forward more than lobbyists flying in. So having that kind of insider knowledge, I think, is helpful. All right.
And then on with healthcare advocacy, obviously I'd love to know more about the form of bill that you are hopefully going to get passed. But with healthcare advocacy, obviously PNHP and this internship is a lot about national advocacy. But I'm curious what I mean. New Hampshire is obviously a pretty important primary state. I'm wondering what your experience has been advocating, particularly on healthcare or working with the political process, where people like Bernie Sanders and everyone who's opposed really bring up healthcare as a big issue. How that has been for you guys?
Yeah. So we are a nonpartisan nonprofit, and so we can't actually get involved in like campaign issues. As a 501c3, we can't like endorse any candidates or kind of work with them on that level, but we do definitely get the federal level folks will come to us and ask to host roundtables, for instance, where they want to learn more about a specific issue. And so they'll ask us to gather some advocates that want to talk about that issue directly to them. So that's the kind of stuff we'll do with federal level delegation, but we are really specifically focused only on the state. I don't know, Megan, if you want to add anything else on that.
And, well, I mean, even in the state, and then healthcare
Yeah.
advocacy in general.
Megan, did you want to add anything? I don't know where she went.
He's having a cat emergency.
Yeah. Oh, there she's back. She's on mute.
Sorry, now muted. What a mess. Sorry, what did I miss?
Ryan, do you want to just ask your question again?
Yeah, I was curious about the experience that you guys have had with doing both healthcare advocacy in the state of New Hampshire, but also what your experience of interacting with national politics has been, because obviously New Hampshire is an important primary state. You guys see national folks all the time, or at least they come through all the time.
Yeah.
And what your experience has been working with them. With my admitted bias is like, I'm really wondering about healthcare, about that part of the puzzle.
Yeah, for sure. So you're totally right. New Hampshire we are lucky to have some definite sway and people coming through pretty constantly. So I think I heard Jess say we're nonpartisan. So we don't do a ton with the national campaigns, but would be impossible to say that them being here and the fact that our legislators are often doing a lot with them didn't have an effect on how on how policy is passed in New Hampshire, or how issues are kind of brought to the forefront. So the way that some of the national organizations, specifically on healthcare, will interact with organizations like New Futures is that they want to have stories themselves, right? Like you always hear people on the floor or in press conferences being like, I talked to Mary and Mary told me, and it's like, you've never talked to that person in your life. But so they'll work with organizations in New Hampshire, especially like ours, to bring forward those stories to, that you say, to kind of help them move forward the issue nationally. So we can be a part of those conversations by working with advocates and helping like national staff know that we're here as a resource and can bring them stories and can bring them patient stories and stuff like that. And then it's just, you know, frankly, people on both sides of the aisle have their candidate coming through. So there can be like, it's often about who's there that week, right? Because we have people coming through pretty constantly. Like, is healthcare coming up a lot this week, frankly, because Bernie was here and he was talking about it, and his, you know, the 4 New Hampshire state senators who are endorsing him are talking a lot in the press about healthcare this week. And how can we make it so that whatever candidate is coming through next week has healthcare on their mind just as much? Is kind of some of the ways that we get involved in that process.
Cool, thank you.
Cool. All right, do we want to talk about personal stories? Anybody have?
Well, I was thinking, oh, just one last thing on this. I would definitely recommend going to your legislature's website and poking around on that and seeing what you can do on that website. This is our nice little website. It's not the best, but it gets the job done.
We can't.
So I would definitely recommend doing that, looking up how you can look up bills there, how you can research different legislators, just kind of what features it offers. Some way you make a profile where you can track legislation and get auto email sent, which I have advocated to our state legislature that we try to get that, because that would be a huge accessibility point for people to be able to track legislation they're interested in on their own time instead of having to go in and look it up every week, because that's just not realistic. So just like looking up those kind of features and seeing how the website can help you with your advocacy. But I was thinking we could take like a 5 or 10 minute break. I know I need to fill up on coffee. And then we can reconvene maybe at 11:10. Does that sound good to everyone? Okay, cool.
So your center doesn't close. And that can really kind of paralyze people and make it hard for them to take action, which is why we always say add the next step to it, which is the solution. So what are the ways that lawmakers can address this issue? In many cases, that's the policy solution you're advocating for. It's, you know, they can address it by voting for this bill, which grants Medicare for all, or voting to expand eligibility for healthcare or increase Medicaid reimbursement rates. Whatever it is that lawmakers can do, it's going to increase the likelihood for action if you give them what that solution is. And you all have a lot of ideas about what that could be. So don't forget when you're telling your story to bring that piece into it. And then the last thing is the impact. So what is the broader impact to society? What's the goal that we collectively are working towards? So with, you know, an increased access to healthcare, it's a healthier, more just, equitable society. With these childcare rates that we were talking about, a society which allows childcare centers to serve the families in our state that rely on them. And you could even bring that up further to talk about the importance of childcare and the importance of families having a safe place to send their children. So that larger kind of impact that this is my personal story and this is how it will affect me, but also this is much larger than just me. And we find that if you can get your story into this 4-part form that you can kind of say short, you know, that was 4 sentences, or you can make it much longer by adding far more detail into each of the issues. But that kind of introduction, challenge, solution, impact is a really effective way to tell a personal story to a lawmaker in your advocacy. Did I do okay, Jess? And so any questions on that? Cool.
Cool. All right. Then we're going to talk a little bit now about some different ways that you can advocate. A lot of these would be taking those personal stories and just kind of modifying them into different formats. So once you kind of write out what your advocacy message is, it's really easy to just repurpose it over and over again. And all the skills we're going to talk about can be practiced safely during this COVID crisis as well. So a couple golden rules for advocates. We just like to preface with this. Basically, treat people how you want to be treated. This especially goes for in New Hampshire, where we're talking about the volunteer legislature, where they truly are just like people, but realizing you catch more flies with honey than vinegar. So if you come in, like, if someone comes up to you and immediately just starts yelling at you, you're not necessarily as likely to listen to all their nuanced points as if someone came up and kind of was just like talking to you like a person. So we do advocate against the yelling method. That's just truly not as effective as getting your point across. Same goes for like online. We'll talk a little bit about social media, but like these rules do apply online. Your lawmakers are seeing what you're writing, and if you're just writing long tirades in all caps, they're less likely to then listen to you when you call them on the phone. Don't burn any bridges. This is really specific to New Hampshire for sure, but everyone's like 1 degree of separation away from someone if you talk to someone for long enough. So just making sure to recognize that even if someone doesn't agree with you on one specific issue doesn't mean that they won't on another. When we work in the 5 buckets that we do in our policy priorities, we have some people that just like really, they totally champion one of our issues, absolutely 100% support it. And then one of the other issues that we are just as passionate about advocating on, they do not understand at all. No matter how much we talk to them, they will not vote for it. But we're not going to write them off entirely because they are still, people are complex, they contain multitudes. And so it's important to realize that just because one person doesn't agree with you on one thing doesn't mean that they won't then be able to help you on other stuff. Anger is the fuel, not the vehicle. So this just means that, of course, we're all advocating because we've seen injustice, and that should absolutely fuel what we're doing. But again, the yelling method is just not as effective at getting your point across. So use your anger to fuel you and be strategic with it. Definitely keep that fire going in you. But again, use it as fuel, not as your main advocacy method. Remember, you are the expert of your story. So you are the expert of whatever you're talking about. And you don't have to have all the answers. Just simply showing up with the information you have is more information than those legislators had when you walked into the room. So it's really important that you never doubt the strength of your story, especially if, I just lost my train of thought, but you don't have to have all the answers. If they ask you a question and you don't know the answer, it's totally okay to say, I don't know, but I will follow up with more information. I think this is particularly true when we're talking with people that are really getting up and sharing deeply personal stories about how a policy is impacting them, to just kind of take away that nervous factor a little bit of, you're not expected to know the ins and outs of everything. You just need to share what you came there to share that day. And then celebrate every accomplishment. This is really about preventing burnout. A lot of times when we're talking about advocating for, especially we're talking about Medicare for all, that's a long-term, really big change. And so it's gonna take a lot of work, and it can get really easy to burn out, especially when you're not seeing like those immediate successes. So you wanna celebrate every accomplishment. If you showed up to testify at a hearing, give yourself a pat on the back, treat yourself to something that night, do something to really keep that fire burning and keep it going, because advocacy is definitely a marathon, not a sprint. So you want to do those things that it's really just, we're advocating for self-care to make sure you can keep the fire going and keep advocating. So here's a couple examples of advocacy. Do I have, okay, yeah, jumping way ahead. We're going to get into a couple of these more closely. Calls to elected officials. This is the #1 most effective way to advocate. We say this over and over and over again, but the most effective way to reach your legislators is to call them. That ensures that you're getting through to them in some way and they are hearing what your message is. We'll talk about emails in a second, but emails are just not as effective because they do get so many emails. So your #1 outreach method should be a call to them. It's helpful to prepare bullet points or a script. If you've written out that advocacy message or personal story, having those bullet points ensures you can keep your message clear and concise, which is not only respectful of your time, but it's more likely that they'll listen to everything that you have to say if you're not kind of just like rambling on, and you're really direct and straightforward with what you have to say and what you're asking them. So bullet points or a script can be really helpful for that. Normally here I would talk about how our state representatives, the numbers that are listed online are their personal numbers. So sometimes when you call them, you get a family member, but that's not really relevant for you guys, but it is a fun fact about New Hampshire that their numbers listed online are their home phones and personal cell phones. So that does throw our advocates off sometimes when like their kid answers the phone and they're like, I thought I was calling the representative, and they're like, yeah, mom will be right there. But if you, one other thing I was gonna say, if you do get a staff person, a family member, someone else answering the phone, just leave a message and say what your name is, what you're calling about, and a callback number. And another piece of advice that we got from a representative was to say specifically, I would like a call back. If you're just saying, I'm asking them to support this bill, that can be left in a written note for them. But if you really want to talk through why they should support the bill, you should specifically ask for a call back so that they know that you want to have a discussion with them. And I would say to keep phone calls, your expected discussion under 5 minutes, maybe 10 if they really want to talk with you. But phone calls are really meant to be short and concise. And I would recommend doing an in-person meeting if you want to have a longer discussion with them. So emails are a great way to reach representatives, but they do get a lot of emails. So it shouldn't be your primary form of outreach. It would be more strategic to call them and say, I will be sending you a follow-up email with more information. Please look out for that, so that they know to be looking for it. You also want to always write the email yourself. They, especially when you're talking about large campaigns or federal level, they do set up spam filters and block filters, and they will block out those like form letters that you can submit. So those are not really effective in getting your message across. Those are more like when they get a mass number of them, that's when they will kind of like notice it. But if you want your email to actually be read, you should really write out the email yourself, draft the email yourself, don't use a form template. Another tip we got is to make the subject line searchable. This might be only true for New Hampshire, I'm not really sure, but it still, I think, is a good practice. If you think about if they're going before a vote to see if they got any emails from their constituents, if you put in the subject line, constituent of the town you're from, or resident of your state, and then the bill number and the issue, that again is just another increases the likelihood of your email getting seen. But I would recommend doing a phone call and saying, please look out for my email, and using email kind of as a follow-up to a phone call too, to send additional information. Maybe you want to send them a letter to the editor that you got published, or a couple articles that support your position. But it should just be kind of a supplemental advocacy tool and not the primary one. So letters to the editor, these are a really great way of getting an issue out in the public and in the eyes of legislators. Especially in New Hampshire, legislators really read the opinion section as if it's coming directly from constituents. It's a way for them to figure out what their constituents care about. So we really prioritize letters to the editor as part of our campaign, as part of our campaign advocacy. There are studies that show you have to hear something 7 times in order to believe it or to change your mind about it. So that kind of repetition of having letters to the editor published every week, every 2 weeks, talking about an issue really elevates that in the eyes of legislators and the public if you continue to see someone talking about this issue. So if you're working with a group of people trying to get a policy passed, it would definitely be strategic to try to get letters to the editor published every couple weeks, so that it remains both in the eyes of the public and legislators. They're about 250 words. They're really short. And you can just research how to submit them to your local newspaper online. Usually there's a pretty clear form that you just have to fill out. And you do need to put in where you live, like your name and where you live, just so that they can verify that you do live in the radius of the newspaper. And like I said, that's also a great thing that you can send directly to your legislators after. You can also post them on social media. There's a lot you can do once you get that link to your published letter. So that's a great way to advocate as well. Opinion editorials, this actually might be something that would be great for you all to submit because they are typically from experts with either professional or personal experience. So someone that has a lot to say about an issue because they are about 800 words. So they're about, I can't do math, 3 times longer than LTEs. And to submit these, you do usually need to email the editor of the newspaper. There's not just like a submission form online because it's more of an article and less of like something on the opinion page with all the other letters to the editor. So I would definitely recommend if you all are doing advocacy around something to consider doing an op-ed. I think that's a great way to get your word out there. Social media, we all know the powers of social media and advocacy, and it definitely can be used really strategically to elevate your mission. And I think it's worth having a conversation about how to do that strategically when you're going about advocating. But it's a great way to build awareness among a lot of people, spread information to the public. This is very specific to New Hampshire, but this is the hashtag that journalists use on Twitter to kind of find information. So we always advocate we always tell our advocates to use that hashtag. But yeah, just remembering that the golden rules apply and there's another person on the other end of the screen. So I feel like I can say this here, but please don't be like our president online and like be respectful to other people. It really ensures that your message is coming across. And actually, I think that's it. So this is the last thing that we always end our trainings with. This is one of our favorite quotes. Most of us have this around our office, but never doubt that a small group of concerned citizens can change the world. It's the only thing that ever has. And we always end by saying, we're a small group of concerned citizens here. So let's go out and change the world, everyone. So does anyone have any questions on any of that before we wrap up? Looks like we're done half an hour early, which is great. You guys get half an hour back.
I have a question on how could I identify similar advocacy groups in Louisiana? I tried to do a little Google search on it, but it didn't come up with anything readily obvious.
Ooh, that's a really good question. So not knowing the landscape of Louisiana. Megan, do you have any suggestions? She might be gone.
A lot of
I'm
times,
here.
Okay.
So I would say that when you're doing your research, using words like advocacy won't always get you far because that word can be used in so many different ways. And a lot of times in the social services field, advocacy groups are doing self-advocacy for like advocating for yourself with a mental health condition in a hospital or something like that. So I would look into like health policy groups or health policy organizations. I would also think about, I know that there is a national organization called Community Catalyst that has a almost like an organization in every state that does health policy work that they're connected with. So if you look into Community Catalyst and see kind of who their connection within Louisiana, that's a good idea. There's another national organization like that called Kids Count. So we're actually the Kids Count organization in New Hampshire, but there is a Kids Count organization in every state. So if you look at that organization, so Community Catalyst and Kids Count have like organizations like us in every state. So you can find who the Louisiana ones are.
Thank you very much. That's super helpful.
Yeah.
I just wanted to say thank you so much for doing this talk because I think like we, as med students, we don't get this talk, and I think it's incredibly important because we have such a voice, and people actually want to hear us for once. So yeah, I just wanted to say thank you, and I definitely want to see if I can get something like this? Or, I mean, even if you guys could come or remote, obviously talk to LSU would be great, because I think a lot of med students really need something like this.
Absolutely.
We'd love to. And thank you all for doing this work, for being a part of this program, and being willing to take the time to advocate and use your voices in this way, especially when we know how busy you all are. It goes really far, and we're really thankful that you're doing this.
Second, absolutely. You all are doing amazing work, and we're just glad that you are interested in this topic, and like Megan said, willing to take the time out to advocate, because you do have such power, and people really do want to hear from you.
I guess I actually do kind of have the question, like, advocating for single payer takes a lot of work, just like learning about it and, being in this internship, and, Asha and I have been, working with the city council thing, and then now we're trying to restart the SNAP chapter. So like, I feel like I put all my eggs in one basket basically, and I'm not able to like advocate for other things that I would love to advocate for, but it's kind of like I'm spread so thin as it is with school. Like, would you recommend like just being super knowledgeable and like advocate for one topic? Or do you see, or like, what are your experiences with people advocating for multiple things at once?
I think it's definitely more strategic to put your energy into something that you're really passionate about and advocate for that. I think that's when you have the passion fueling you, it's less likely that you're going to have burnout. And so I think definitely if there's other things you care about, you can do kind of like just make a call to your representative and ask them to support something, and do those kind of like lower energy commitment advocacy things. But when you're talking about trying to get SNAP reinstated, that's a big undertaking, and that's going to take a lot of your energy, and you do definitely need to practice self-care with advocacy and realize where your limitations are. Speaking from personal experience, when I first got really involved in advocacy, I totally burnt myself out. I just threw it all in at once, head first, and then once the legislation passed, I was like, I can't do anything else. I spent all my time, like I gave everything to it. And so it's really, I think finding that balance is important in the long term so that you can continue to do the work. And so, I mean, I know I still personally struggle with that, and especially with everything going on in the world right now, and wanting to lend your voice to so many different really important things, and like everything, you do need to figure out what that balance is and where you can best put your energy to make the most change, I think. So I think what you're doing is totally right. You're putting your energy into something that you really care about. I think it's important to continue to balance that, and you know yourself and you know what you're capable of. Like, you might be capable of doing more than someone or less than someone, but it's about doing what you yourself are personally the most capable of to make the most change. I always talk about you can't pour from an empty cup. So you have to make sure you're taking care of yourself before you can help other people.
This is Marvin. I have a closely related question, but I think it's a little different. Can you hear me?
Yeah.
Okay. So just recently, PNA, the National Organization of Physicians for National Health Program, which we're all part of, decided that it has looked bad for the organization to work on this one issue, single payer reform, and felt that it would be strategically helpful for us to be seen as supporting other movements which I think everyone would call liberal or progressive, like the Poor People's Campaign, a lot of the Black Lives Matter activity, and other topics that are not directly related. And part of the reasoning was that we wanted to be seen as supportive and begin to work in coalitions. And I've been to many demonstrations where it seems like every liberal group is there doing their thing. And to me, it looks less effective. As people who are MDs or soon to be MDs, we have more credibility to talk about health policy than these other areas, and we're all really busy. So I guess I'm a little confused about what to do about other issues that we may well agree with. Personally, I do all of my activity in this issue, and I actually donate much more money to other causes that I believe in. But this is where I put my time because I feel like I have more credibility and I just know more. What do you think about all that? I'd love your opinion.
Ooh, those are great questions. I think you can go about it in a lot of ways. I think it's really important to understand the intersections of a lot of different issues. So recognizing that these issues are multifaceted, and so it's important to bring a lot of different perspectives into the advocacy work that you're doing. And I think you can go about still advocating for an issue while also recognizing the way that it plays out in other issues as well. I'm thinking about coalitions. I think that's a great way to lend your voice to a lot of different areas. We sit on a number of coalitions and provide our perspective. And also, it's a great way to learn about what else is going on in your community and what other needs there are in your community. That's a lot of what our work is doing, is trying to figure out what the needs on the ground are and making sure that our advocacy is reflecting that. So I think you can still maintain a focus, like we still maintain a focus on our 5 policy bucket areas, but we also recognize that health is impacted by a lot of different social determinants. And so it's important to keep that perspective while you're advocating and make sure that you are advocating for everyone. Megan, I don't know if there's anything else you want to add.
Yeah, I think I love the idea of like participating on those coalitions, because there are so many different groups with different perspectives, but also like there is a reality that some of those groups have more of a progressive like the way that they're viewed by lawmakers is that they're more progressive, and there are some more moderate organizations that are still pushing for healthcare reform. And so I think it's a really great idea to be on a coalition with all of those and just find out where realistically and honestly your voice fits on that spectrum. So I personally think for a movement to have any weight at all, it needs kind of all of those different perspectives, right? It needs to be pushing from like the very far left and some people more moderate, and that there are organizations that are doing that. So I always suggest being a part of a movement that has all of those pieces to it and finding out, like genuinely doing some introspection about where does your organization fall on this and how can we most honestly and genuinely participate in this larger group, and not trying to think that you're going to do it all on your own, or that you as an organization can or needs to fit into every bucket, but putting yourself where you most think that you can make a difference, and knowing that there are other organizations who are going to kind of fill in around you. That makes sense.
Thank you.
So for instance, I'm just thinking of this too. There's issues, for instance, like reproductive rights. So as a health policy organization, we do support those issues, but there's Planned Parenthood advocacy arm in New Hampshire that takes on the primary role of that. So we're not going to lead the charge on that. However, we do support them and sit on their tables and lend our voice when they identify more advocacy around this in order to get this bill passed. So then we'll lend our voice and support it. So if there's another organization leading the cause, we will just step up to support them, but we won't take over leading that cause. We'll kind of just, as they identify things that they need in order to push their cause forward, we'll kind of lend our voice to support that. And then we will expect the same kind of from them as we're leading the charge on our different issues. So it's also about not reinventing the wheel. And if there's already someone doing the work, just lend your voice to support them and follow what they identify as their needs and help support them that way. I think that that's a really effective kind of model. And that just ensures that, again, there's not multiple people doing the kind of the same thing, but none of them are communicating. We want to make sure that it's most effective when you're in numbers. And so if you can all support each other in your different ways, I think that that's another really effective way to get a lot of issues that all kind of intersect to and legislation around them.
What you just said, I just am remembering from, you know, my time working for nonprofits, doing advocacy work. I mean, I can't point to, I can point to some specific examples of successes, but not on major policy issues. But I just remember being a part of coalitions and sort of maintaining open lines of communication, at least sort of in your sector of advocacy, I think is critical. But I mean, I assume PNHP is doing that. You know, I assume that's sort of standard at this point. But I know that that was always a big deal for us.
Any other final thoughts before we wrap up?
No, thank you so much, though. Really appreciate it.
Yeah, thank you a lot. This was super helpful.
Oh,
Thank you.
wonderful.